My company, CareGenesis, is really focused on trying to alleviate some of the burden of caregiving. So our company is really focused on the caregiver rather than the care recipient that has disease. We know caregivers are sicker as a result of being caregivers, and because of that, the caregiver burden is really quite great. When you try and track somebody, it's not that difficult to track somebody that will wear a tag. But when you have somebody with cognitive impairment, like an older adult with Alzheimer's disease or a child that has autism, they're not going to wear that. So it's really critical when we're trying to make sure that we know where those care recipients are in the home that have cognitive impairment, that we have a monitoring system that's not based on them wearing a tag. So the way that the system gets used is that the caregiver puts the care recipient in the bed, and then that little blue light there says that the care recipient is in the bed. So the first thing that the caregiver does is that they push the night mode button.
Night mode on.
And as long as the care recipient is in bed, the little blue light here will be on. And in addition to that, the caregiver is free to move around the home, and these sensors won't activate at all. So the bed occupancy sensor tells the system when the care recipient is in the bed and they're safe. So we can then ignore, the system then ignores any activations from the sensors, the other sensors that are in the house. But as soon as the patient gets out of bed, then the alarm will say that they're out of bed, and every one of these sensors now becomes active. What's really important in developing products in this space is that there's not only a business case for the product and the business is developed, but also the research is developed that really demonstrates that the product is useful in terms of improving outcomes for individuals. So within this Florida high-tech corridor, we have a whole population of scientists that are focused on aging. We're focused on caregiving, particularly here in this lab. And we really have the opportunity between the health sciences, the social sciences with gerontology and aging, as well as the engineering sciences, to begin to create these interdisciplinary teams that can develop technologies that are specifically aimed at trying to figure out how do you support an individual who goes from a healthy role to a role of chronic illness and allow them to age in place. So what I'd really like to contribute to our industry's future is an understanding of the need to look not only at the person that has the illness, but also to look at their caregiver. And that caregiver is their best pal.